working at a health unit offers something similar to what a community health center might provide, but it's more of a little bit of a mix. So what you'll find working in the public health unit is that part of your role will involve meetings with partnerships, meeting with your peers from different organizations, kind of systems level discussions, but also you'll have opportunity to connect directly with people as well. So it's a good mix. So if you're someone who wants to have your pulse on some upstream work while also not losing complete connection with the people that you're serving, health unit's also a great space. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Continuing our series where we talk about organizations that hire public health professionals, in this episode, we'll feature public health units. And public health units have a variety of different names that they're referred to in the Canadian provinces. Sometimes it's called Regional Health Authority, Regional Health Unit, Community Health at the end of the name, something of that nature. So every province has their own system. In this episode, we'll focus specifically on Ontario as a province in Canada. And there are currently 34 health units in Ontario, Canada. The reason I say the word currently is because sometimes there are different pressures from the provincial government where health units might amalgamate, where it makes business sense, or to streamline services. So sometimes that number might go up, sometimes the number might go down, depending on the situation. But at present, there are 34 health units. There will be a link in the show notes that directs you to a page that shows all of them. I also have a LinkedIn post where I show all of the health units in Ontario. Mm-hmm. Now, what are these shiny public health unit things, Perva? What is that?
So essentially, the role of public health units, they work with the community to promote better health, prevent disease of the population as a whole. And so it's an important part of our generally publicly funded healthcare system to administer health in a regional aspect by province and by territory across the country. So there's a lot of stuff that public health units do, but the main role is to promote and protect the health and well-being of the citizens of that specific province or territory. And they're often, or they are actually, governed by regional boards of health. So there are a lot of standards that they have to work within. And as Gordon mentioned, are often affected by the current provincial government's goals for public health as well. So it can go back and forth. I think it's a pretty organic, it seems like it shouldn't be organic, but it kind of is, right, Gordon?
Yeah, it kind of is. And to your point about the mandate being provided by the provincial government. So the way it works, like, of course, just like community health centers, public health units are also regionally distributed. They exist in a variety of communities. One single health unit entity might serve several communities as well, depending on where it's located and the jurisdictional lines and things of that nature. And so as well as similar to community health centers, you're able to have health units that are responsive to the needs of the communities in which they serve. And that's why there's always the argument for centralized versus decentralized. So in this sense, having a health service delivery be a bit more decentralized and regional, you're able to tailor it to specific needs of people. So that's similar to community health centers.
How do they differ, though? Because I feel like what we've talked about so far and how they cater and service to the population is very similar. But, you know, like community health centers, they are not-for-profit organizations, whereas public health units are essentially the government funded way of providing health. So how do they really differ in the way they function and provide services? Because right now they kind of sound the same to me, and I'm sure to the listeners too.
That's a good point. From a governance perspective and a mandate perspective, it's quite different. So the health units are fully government funded. It's usually a cost share model between the municipality in which a health unit exists and the government. There's like a splitting of costs. I believe now 70% comes from the Ministry of Health and 30% comes from the community itself. So the municipality or local government. But the way health units function is the province has what's called Ontario Public Health Standards. And it outlines a minimum set of services and programs that the health unit needs to take on to basically keep getting that money. And like it's what they're kind of held accountable by. And to a large degree, it's very general, but to a large degree, it's also very specific in the types of things that it asks the health units to do. So when you talk about mass vaccination campaigns, right, that's something health units often get involved with. We saw that with the COVID-19 pandemic. From a health promotion perspective, the public health units are basically given authority or brought into existence from what's known as the Health Protection and Promotion Act, which basically delegates powers to a health unit to be able to do certain things. A very kind of extreme example that might illustrate how a health unit differs from a community health center is a community health center, talks about reaching hard to reach people, similar to what a health unit does. But a health unit has like a medical officer of health, which is given powers under this act, and they can make certain kind of public health decisions in a region. So they can literally say they can shut down bars and restaurants, food premises, and like personal service settings like nail salons if there's a public health risk to the public.
I see.
And that structure doesn't really exist in the community health center level. They don't really have that government power to do different things. It's sort of an arm's length from the government, whereas public health is more of an extension to some degree, but still independent in a way from the government. And I would say health units, there's more of a variety of different types of programs, right? So a huge piece for public health units too is around the epidemiology side of things too, very housing the data, interpreting the data, understanding the distribution of disease. And health units will work closely with community health centers to see what makes sense for service delivery. At times it might be the health unit, and sometimes it's community health center, sometimes it's both. So there is a synergy there, but there's some clear distinctions, and then there's some things that are a little bit more of an overlap.
Yeah, it seems that I imagine that public health units work quite closely with community health centers for a lot of their services and outreach programs. But public health units seem so much bigger. Like you mentioned that there's things about access to safe food being one of them, and ensuring that restaurants are inspected, and you're investigating things like this. But then there's also at-home visits and disease prevention. It seems like there's so much happening at public health units. And if anyone that doesn't know, Gordon, for a majority of his career so far, has been with public health units. And you have been able to see so many aspects of it. What do you think is some of the hardest? Like, is this diverse ability to provide services? Obviously, it's a great role and you are able to help so many people. There must be challenges with working in a public health unit in the same way as well.
So you touched on it there, that there are a diversity of programs and services. Some are, like I said, Health Protection and Promotion Act. Health protection are things like environmental hazards. You're talking about vaccination campaigns. You're talking about making sure there's safe food, safe water. Health promotion is more on the behavioral side and the kind of social determinants of health side, understanding what the enablers of healthy behavior and working on that side. So based on that mandate and that approach, you can understand, like you mentioned, there's different healthy families program, healthy schools program, environmental health programs. There's substance use, mental health, a lot of these different things. And a lot of what health units do is provide leadership. A lot of times how resources are distributed in a community health units are resourced in a way to be able to provide that leadership, right? So by that very nature, it comes with a lot of challenges, right? In the community, there's several agencies in some shape or form that are funded to do something that is quite similar. So if you think of a big challenge like substance use, in a given community, you have several agencies. Sometimes you're stepping on toes, but you have to get everybody together. The health units are often recognized leaders in their communities for these kind of complex issues. And being in a position where at times health units are not directly involved in service delivery. So for example, you won't find really health units where there's like mental health services provided in terms of direct support, like counseling, psychology. That's really not something that's typically in public health mandate. So if you're working on a comprehensive mental health strategy, for example, you're talking about upstream prevention, you're talking about secondary prevention and tertiary prevention, right? Which involves kind of service delivery for people who are experiencing symptoms. So working with a variety of partners comes with a lot of challenges, right? So that's in the day-to-day work, that's a challenge. But also one of the pieces that you're getting at too is government changes. Obviously, it's a publicly funded system where the government contributes a significant amount of dollars and therefore is able to, in some way, dictate the types of priorities that exist at the local level.
Right.
And one of the challenges right now, I will say as well, is that prevention work, which is historically been challenging to quantify the effectiveness of it, right? So a campaign to tell people about the risk of cannabis, right? How do you know it worked? Like, and what does working mean? So governments, especially conservative governments that are looking to kind of save dollars, will look more fondly at things that can be quantified, like how many vaccinations were given, how many things at the sexual health clinic were given versus, we have a safe consumption site and we saw, so in that sense, it becomes challenging where there's a clash between like values, doing the right things, and then what you're funded for. And that's something that you have to navigate at a health unit level because you're an extension by the government, but you function independently, but you're also influenced very heavily by the government. And you have your local context that you're dealing with, and those things don't always align.
Yeah, you're juggling a lot of interests and also obviously keeping up with the public health standards that themselves need to be also are an interest that you need to maintain. That's so interesting. I never really considered how, because I think being in public health and global health, you know the value of prevention based campaigns and things like that. But it's so true. It's hard to quantify that. And I think a lot of reporting on health of prevention based campaigns and such, I feel like qualitative based data isn't considered as strong as quantitative by people that aren't necessarily in the field. And while we know that qualitative data is an asset on its own, like you're getting these lived experiences and remarks from the people living through things, that it's hard to basically make a report that can say we need to continue doing this because of so and so reasons, or even like flu campaigns and things like that. Like, how do you know it's really working well aside from counting how many people got flu shots? But yeah, it's a really good point. I had never really thought about it that way, but I can imagine that's a difficult thing to balance for sure.
Yeah, but I will say that public health should also take some responsibility for that as well, right? I think we should and could do a better job of, and obviously you can get into how people are trained, education, and then the funding for different types of roles that might better enable this level of thinking to be able to, you're right, you can get into all of that. But I think there's a responsibility on public health to kind of demonstrate value for money, right? We live in a value for money system. And if we're not able to demonstrate value for money in a way that resonates with a funder, that jeopardizes you being able to get that money. So, like you touched on things like flu campaign. I think that's a bit of a different one in that you could see maybe vaccination rates go up and then incidence of flu goes
Right.
down, and you read that's the outcome, and then
Yeah.
transmission goes down, and like you can demonstrate that if it works effectively. But then if you're doing diabetes education programs
Right.
for prevention,
Right.
you're talking about chronic diseases that develop over time, where
Yeah,
there's
how do you
sort of
quantify that? Yeah.
no positive outcome immediately tied to the intervention, right?
Yeah.
How do you demonstrate value for that when
Yeah.
someone might have developed diabetes 10 years from now had you not provided them the tools? Like, how do you, right? And then,
also
so
when
you
it's
resort to education, right? How many people showed up to the webinar, to the community event? And that's what you're reporting on. And that's not very attractive
yeah.
to a funder. Yeah, we had 30 people at the event. Okay. And, can you give me a little bit more than that? And that's something we struggle with.
Do you think the increase in the understanding and impact of knowledge translation and dissemination has had a positive role in kind of showcasing things like webinars and campaigns? Like, they clearly are a positive way of providing education. And I think knowledge translation and mobilization has become understood as a very important aspect of public health. Do you think that has changed at all, or is that still a way away, like a ways away?
So what I would say to that is that when you're talking about best practices and professional practice and learning at like the professional level, what you'll hear, right, is folks like you and me who are in the space trying to learn how to do things better. We get value out of those things, right? So you'll invariably hear that sharing knowledge and best practices in a timely way that's easily digestible is a positive thing. But the challenge with that is linking that to actual results that we kind of care about. And when you're competing against, right, wait times, hospital wait times, if, you know, logically, if wait times are high and you build another hospital, then you might cut wait times. So that's an easier sell, even though you're looking at billions of dollars.
Yeah.
Right? Then like, hey, no, if you invest something now, the incidence of diabetes might go down 1% in 20 years when you're no longer in office to take credit for it.
Yeah.
That's not science. If I'm trying to run an election cycle, I know which one I'm going to fund. Right. So it's unfortunate that that's the way it is. And maybe that means that there's bigger reform to like government and like how health-based decisions are tied into like politics. Like that might be a broader discussion, right? Obviously there's chief medical officers of health that are like, but they're still kind of tied to the political world, and decisions are still right? So you can get into all of that. I'm not sure what the solution is, but I think in my message to people who are training in public health now is like, everyone has a role in program evaluation, right? And just as it's important to know when something works, it's also important to know when something doesn't work and share that so other people don't do that.
Agreed. Yeah, absolutely.
Okay? So I think that's probably the way forward, Purva, where it's not necessarily that we're looking to move the needle, because we're talking about chronic diseases in many cases. And in my lifetime, I might not even see the needle move in some of the things that I'm working on right now.
Yeah.
Right? And I have to accept that. But what we can do a better job of doing is sharing in a like systematic way about the things that we've done that work and the things that we've done that hasn't worked, so that the things that objectively don't work are not repeated. And then we can kind of go through a more rapid learning cycle. And then maybe we get closer to something where universally there's a practice that's commonly accepted because it has worked in most settings. And then we could kind of accelerating the learning of positive interventions, but we don't do a good enough job at that, I must admit.
Yeah. So would you say that public health units working with the populations and individuals themselves, of course, but almost in a more systemic approach rather than an individualistic issue? Like when we talked about community health centers, you're really working with the people and targeting the specific problems and barriers they are facing. You're doing similarly with public health units, but I think in a more systemic way. Would that be, yeah?
Yeah, I agree. And so a little bit more upstream. Obviously, there's some service delivery there as well, but you're working with partners and playing a role in that partnership to advance like the positive health outcomes.
Right.
So if you're working with, if a public health unit works with a community health center, health units tend to have a lot of expertise in knowledge mobilization, knowledge translation, and maybe
the current standards of provision of care.
That's right. Right. The best evidence-based practices, kind of how to communicate that. And maybe that's the role in the partnership while, community health center, a little bit more frontline, door-to-door, person-to-person, and we can kind of worry about the mass communication part, right? So there's different roles for a health unit, like you said, in a more kind of connectee systems level way, but then there's also overlap as well.
So kind of pivoting to working at public health units, we've talked extensively about what they are, what they do, how they function. But those that are interested in working in public health units, like what type of advice, I guess, you would give to them to know if they are the right fit? Like, do you think, we mentioned with the community health centers that if you really like working directly with the people you're impacting, this is a great way to do so. Who do you think would be most interested with public health units and would find that work really invigorating for them? It doesn't have to be maybe invigorating, but like interesting to them.
So in that sense, working at a health unit offers something similar to what a community health center might provide, but it's more of a little bit of a mix. So what you'll find working in the public health unit is that part of your role will involve meetings with partnerships, meeting with your peers from different organizations, kind of systems level discussions, but also you'll have opportunity to connect directly with people as well. So it's a good mix. So if you're someone who wants to have your pulse on some upstream work while also not losing complete connection with the people that you're serving, health unit's also a great space. Obviously, it depends on the role that you have, right? So if you're in a leadership position, you're in any organization, really, you're like more far removed from the day-to-day frontline connecting with populations that you're meant to serve. But if you're looking at sort of those roles that would ordinarily be interacting with people, those roles also exist at the health unit level as well. So I would say if you're someone that likes a variety to your work, right, and a little bit more not putting your eggs all in the same basket, public health units, I should say, is something to consider as a potential place to work for sure. And, just like a community health center, there's tons of different roles that you can do at a public health unit. Some that are regulated, some that are not.
Oh, okay. I might touch on some that I'm aware of, but do tell about this regulation versus unregulated, because I was not really, I guess, some regulated ones are like, you've got your doctors and nurses that have very regulated ways of practicing. You've got social workers here sometimes as well. Some of the unregulated, so to say, health promoters. Gordon, you did that for a long time, of course. Health promotion. You've got planning and evaluation specialists, policy and program analysts. Health educators is a big one. And that can be very, divvied up into what type of health education are you providing? Are you working with schools on, safe food practices or like with restaurants? Or are you going to be working at the sexual health clinic where you're talking about education on STIs, safe sex? You've got community health workers. Are there any other ones that you kind of, like, these are very similar to the ones we talked about in the community health center, but I think generally in a lot of public health, you do have a cross-cutting and multidisciplinary approach to providing public health services either way. So I think when people are looking to work in health units, they're going to find such a diverse set of opportunities that might, and I think that's really great because then they can find stuff. If they want to work with population health, they have that option. If they want to be working specifically on outreach, they can also have that option. And so there's something I think for everybody there, which is great.
Yeah, and yeah, very similar in terms of the roles that are regulated, right? So you have in terms of dentistry, you
Right.
think of dental hygienists and
Right.
dentists. So health units are funded for a lot of oral care and oral health programs, right? So to serve underserved populations.
I actually didn't know that.
There are specific programs for seniors as well who are
Mm-hmm.
low income that health units provide services for. That's one of the few areas where health units will do completely direct service delivery in addition to like sexual health, vaccination, and that type of thing. And then so you have other roles like public health inspectors as well that are involved in like the water safety components of things, food safety components, and they are actually also regulated health professionals. You have to kind of go to a specific program, get a license to practice as a public health inspector. You also have epidemiologists and data analysts, folks that work in the data. I talked about program evaluation as well, being important to demonstrating value for money or to demonstrate the impact or effectiveness of a program. Those are very important roles. But one more global thing to touch on is health units tend to be unionized. So the implication of that is health units will often be more strict with educational requirements because it's a unionized position and it's non-negotiable. If it says a master's in this or equivalent, you're never going to be considered unless you have that. So health units are one where if you don't meet the educational, people have different advice for, if you meet 50%, then go for it. If not, right? Educational requirements for public health unit jobs that are unionized, if you don't meet the education requirements, don't waste your time.
That's good to know.
In fact, it's sometimes even if you have a master's but you haven't kind of graduated or got sometimes you might not even be considered. Right?
Oh,
It's
wow.
that strict. It's sometimes, right?
Wow.
So that's something to consider, right? The impact of a unionized environment and unionized positions in terms of your eligibility as a candidate to get those jobs, right? Most health units, if not all, are unionized. Not all positions would be unionized, but most positions would be if it's sort of non-management. Coordinator positions and management positions and leadership positions are typically not unionized, but everything else would normally be. If you take out like doctors and dentists,
Right.
those wouldn't be unionized, but nurses are and other positions are. So
Very interesting.
something to think about when you're looking to explore different opportunities. But like I said, health units offer a range of experiences. And because of the union, though, the benefit of the union is that if you meet the educational requirements for a different job classification in a different department, right, you can move around. Right. So
Yeah.
you might be doing health promotion for substance use, but something came up in oral health and you're interested in that, you can move. You can move over.
There's opportunity to diversify your knowledge very easily.
That's right.
Yeah.
That's right. So that's the benefit of working at a health unit.
That's for sure. Yeah. Very interesting.
So again, there's a bunch of key skills and competencies that you need that are important, and communication is always important. I think sending a good email is underrated, and I say that a bit tongue-in-cheek.
It's an art,
But
I swear.
It's an art.
Yeah.
People appreciate a good, well thought out, concise email that you kind of coherently put together, that has clear direction, presents information in a clear way. So when we think about communication, we're not talking about how good you are at a presentation or with the media. Sometimes it's the little hallway conversations, the little emails back and forth, the little one-page reports that you develop that kind of stand out to make people think and believe that you're a good communicator. And then obviously, the other components as well.
Yeah, and I also, just aside, was thinking about some friends that I have that are in, the comms field, so to say. They've worked before at public health units and, worked on that design assets of public health and creating those infographics and informational booklets for those that visit public health units. Any campaigns that they're working on, they're on the team to create the communication services and assets that are used for those campaigns. And most of the time, these are people who have science backgrounds because they have that working knowledge on the stuff that they're designing, but they have pivoted into the field of communication and not necessarily like the service provision, which I think is a really cool cross of two different fields I've been seeing a lot recently in public health, communications and public health. It's very interesting. I think I see more and more people kind of pivoting into that. But aside from that, of course, working with diverse groups of stakeholders and populations is also another key skill and competency to have in this specific roles. And of course, policy and program planning. You know, we talked extensively about looking at the various projects and campaigns that are put into place, evaluating how well they're doing, and having that learning cycle. You put something into place, continue to analyze it, see its outputs, and then use those outputs and results to evaluate how it's currently working, and then go back to the drawing board of that cycle of continuously improving things based off of new knowledge in public health and medical sciences, but also based off of government interests and community interests as well. So that's definitely another one. Yeah.
Splendid. So if you like this, obviously we'll share a few resources in the show notes for you to check out if you want to explore where those health units are, learn more about the health units. It also connects to the different health unit career pages if you want to take a look to see what resonates with you. And of course, in general, you want to be tailoring your application to what the duties and responsibilities and requirements are in these positions, and using similar terminology that the job posting uses. Like, that's one thing I think people struggle with. Like, just understand that HR is the one reviewing your resumes in most cases. Health units have HR departments. Before the subject matter expert in the hiring manager even sees your resume, 95% of resumes have already been screened out. So you have to make sure to showcase your thoughts and ideas accordingly on a resume for someone who doesn't really know as much about public health as the person who's actually going to be hiring you and you're going to be working with. So keep that in mind. If you love this series, we'll talk more about other public health organizations that hire public health professionals. But for now, Pervat Gordon signing out.
Bye.
Peace. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.